Question 1. Upon reviewing the case of an 85-year-old client diagnosed with multiple chronic conditions, including advanced osteoarthritis and type 2 diabetes, who expresses to their clinical social worker, "I'm tired of fighting this. I just want to be comfortable now," what is the most appropriate initial clinical social work intervention? Option A. Provide the client with detailed educational materials on cellular senescence and the biological mechanisms of their chronic diseases to help them understand the inevitability of aging. Option B. Immediately inform the client's physician that the client wishes to cease all medical interventions and focus solely on comfort measures. Option C. Refer the client for an immediate psychiatric evaluation to assess for severe depression and potential suicidal ideation. Option D. Conduct a thorough psychosocial assessment to explore the client's understanding of their biological conditions, their current symptoms, their emotional state, and their definition of comfort, while also assessing for potential depression or other mental health concerns that may be influencing their expressed wishes. Correct answer is D. Conduct a thorough psychosocial assessment to explore the client's understanding of their biological conditions, their current symptoms, their emotional state, and their definition of comfort, while also assessing for potential depression or other mental health concerns that may be influencing their expressed wishes. Explanation. This scenario is professionally challenging due to the intersection of a client's complex biological realities of aging, including cellular senescence and the management of multiple chronic diseases, with the clinical social worker's ethical and regulatory obligations. The client's expressed desire to stop fighting and focus on comfort, while understandable, requires careful assessment to differentiate between a natural progression of illness and potential signs of depression, or a desire for hastened death, which carries significant ethical and legal implications within the clinical social work scope of practice. The correct approach represents best professional practice because it prioritizes a comprehensive, client-centered assessment that respects the client's autonomy while ensuring their safety and well-being. This involves a thorough exploration of the client's wishes, understanding the biological underpinnings of their symptoms and prognosis, and collaborating with the interdisciplinary healthcare team. This aligns with the ethical principles of beneficence, non-maleficence, and respect for autonomy, as well as regulatory frameworks that mandate appropriate assessment and intervention for clients experiencing end-of-life concerns or significant health declines. Specifically, it adheres to guidelines that require social workers to assess for and address potential mental health conditions that may influence end-of-life decisions, and to advocate for appropriate palliative and supportive care. An incorrect approach that focuses solely on the client's stated desire to cease medical interventions without further assessment would be professionally unacceptable. This failure would violate the principle of beneficence by potentially overlooking treatable depression or other factors influencing the client's decision-making capacity. It could also lead to a failure to uphold the client's right to receive comprehensive care, including palliative and hospice services, which are designed to manage symptoms and improve quality of life. Furthermore, such an approach might neglect the regulatory requirement to ensure informed consent and to assess for any coercion or undue influence. Another incorrect approach that involves immediately escalating to a formal psychiatric evaluation for depression without first conducting a thorough psychosocial assessment and exploring the client's understanding of their biological condition and prognosis would be premature and potentially alienating. While depression is a concern, it is crucial to first understand the client's lived experience of their chronic conditions and the impact of cellular aging on their overall functioning and outlook. This approach fails to acknowledge the complex interplay between biological factors, psychological distress, and existential concerns common in gerontology. A third incorrect approach that involves solely focusing on the biological aspects of aging and chronic diseases, providing information about cellular senescence and disease progression without adequately exploring the client's emotional and psychological response, would be incomplete. While understanding the biological context is important, it does not address the client's expressed emotional state and desire for comfort. This approach neglects the psychosocial dimension of care, which is central to clinical social work practice, and fails to provide holistic support. The professional decision-making process for similar situations should involve a systematic approach. First, actively listen to and validate the client's expressed feelings and concerns. Second, conduct a comprehensive biopsychosocial spiritual assessment, paying close attention to the client's understanding of their biological conditions, their current symptoms, their functional status, their emotional state, and their support system. Third, explore the meaning and implications of their desire to stop fighting and focus on comfort, differentiating between acceptance of natural aging processes and potential indicators of distress. Fourth, collaborate with the interdisciplinary healthcare team, including physicians, nurses, and palliative care specialists, to ensure a coordinated and holistic care plan. Fifth, document all assessments, interventions, and communications thoroughly, adhering to all relevant ethical codes and legal mandates. Question 2. The efficiency study reveals that a significant portion of initial client assessments in gerontology are being completed using only standardized screening tools. A clinical social worker in gerontology is presented with a new older adult client exhibiting signs of social withdrawal and occasional forgetfulness. The social worker has administered the Geriatric Depression Scale, GDS, and the Minimental State Examination, MMSC. Considering the efficiency study's findings and the client's presentation, which of the following represents the most ethically sound and professionally appropriate next step in the assessment process? Option A. Solely rely on the numerical scores from the GDS and MMSC to determine the client's level of depression and cognitive impairment, and then formulate an intervention plan based exclusively on these scores. Option B. Focus exclusively on the MMSC results to assess for cognitive impairment, and if the score is within the normal range, conclude that the forgetfulness is not a significant clinical issue and move to other client needs. Option C. Immediately refer the client to a psychiatrist for a full psychiatric evaluation based on the initial GDS and MMSE scores, without conducting further clinical assessment. Option D. Proceed with a comprehensive clinical interview, incorporating the results of the GDS and MMSE as a starting point for further exploration of the client's psychosocial history, functional status, and environmental factors. The correct answer is D. Proceed with a comprehensive clinical interview, incorporating the results of the GDS and MMSE as a starting point for further exploration of the client's psychosocial history, functional status, and environmental factors. Explanation. This scenario presents a professional challenge due to the need to balance the efficiency of assessment with the ethical imperative of providing comprehensive and individualized care to older adults. The efficiency study highlights a common tension in clinical practice: the desire to streamline processes versus the potential for oversimplification or overlooking critical nuances in assessment. For a clinical social worker in gerontology, CSWG, this requires careful judgment to ensure that assessment tools are used appropriately and do not become a substitute for clinical expertise and client-centered evaluation. The correct approach represents best professional practice because it prioritizes a multifaceted assessment that integrates standardized tools with a thorough clinical interview and observation. This aligns with ethical guidelines that mandate a holistic understanding of the client, considering their unique psychosocial, environmental, and cognitive factors. Regulatory frameworks for gerontological social work emphasize the importance of individualized assessment to inform effective intervention planning and to ensure client dignity and autonomy. Using the Geriatric Depression Scale, GDS, and the Minimental State Examination, MMSC, as starting points, but then proceeding to a comprehensive clinical interview and collateral information gathering, demonstrates adherence to best practices by acknowledging the limitations of any single assessment tool and the necessity of a broader clinical perspective. This approach ensures that the assessment is not merely a data collection exercise, but a foundation for building rapport, understanding the client's lived experience, and developing a tailored care plan. An incorrect approach that relies solely on the numerical scores from the GDS and MMSC without further clinical exploration would represent a significant regulatory and ethical failure. Such an approach risks misinterpreting symptoms, failing to identify underlying causes of distress or cognitive impairment, and potentially leading to inappropriate or ineffective interventions. Ethically, it violates the principle of beneficence by not ensuring the client receives the most accurate and beneficial care. It also risks violating the principle of non-maleficence if a misdiagnosis leads to harm. From a regulatory standpoint, it fails to meet the standard of care expected for a qualified CSWG, which requires a nuanced and individualized assessment process. Another incorrect approach focusing exclusively on the MMSE to rule out cognitive impairment without considering the GDS or other indicators of depression or psychosocial distress, would also be a failure. This overlooks the significant impact of depression on cognitive function and vice versa, leading to an incomplete diagnostic picture and potentially inadequate treatment. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the client's presenting concerns and the purpose of the assessment. 2. Select appropriate assessment tools that are validated for the geriatric population and relevant to the presenting concerns. 3. Administer and interpret these tools within their intended context, recognizing their limitations. 4. Integrate the findings from standardized tools with information gathered through a comprehensive clinical interview, direct observation, and where appropriate, collateral information from family or caregivers. 5. Synthesize all gathered information to form a holistic understanding of the client's strengths, needs, and challenges. 6. Develop an intervention plan that is individualized, evidence-based, and responsive to the client's goals and preferences, ensuring ongoing reassessment as needed. Question 3. Examination of the data shows an 85-year-old client expressing a strong desire to return to living independently in their own home, despite recent hospitalizations for falls and a diagnosis of mild cognitive impairment. The clinical social worker has observed the client to be somewhat forgetful, but otherwise lucid during recent sessions. The client's adult children are concerned about their parents' safety and advocate for placement in an assisted living facility. What is the most appropriate next step for the clinical social worker? Option A. Document the adult children's concerns and proceed with arranging for home health aid services without further direct assessment of the client's capacity or wishes. Option B. Advise the client that returning home independently is not feasible given their recent falls and cognitive status, and focus on facilitating their transition to assisted living. Option C. Immediately initiate the process for guardianship proceedings to ensure the client's safety, given the concerns raised by the adult children and the client's age. Option D. Conduct a comprehensive functional assessment of the client's ability to manage daily living activities independently, and explore the client's understanding of the risks and benefits associated with their desire to live alone. The correct answer is D. Conduct a comprehensive functional assessment of the client's ability to manage daily living activities independently, and explore the client's understanding of the risks and benefits associated with their desire to live alone. Explanation: this scenario is professionally challenging because it requires the clinical social worker to balance the client's expressed wishes with the potential for harm to themselves or others, all within the framework of established gerontological best practices and relevant regulations. The aging process can bring about complex cognitive, physical, and psychosocial changes that may impact an older adult's decision-making capacity. The clinical social worker must navigate these complexities with sensitivity and adherence to ethical and legal standards. The correct approach represents best professional practice because it prioritizes a comprehensive, client-centered assessment of the older adult's capacity and the underlying reasons for their expressed wishes. This involves exploring the client's understanding of their situation, the risks and benefits of their choices, and any potential external influences. It also necessitates consultation with relevant professionals and consideration of available support system, aligning with the ethical principles of autonomy, beneficence, and non-maleficence, as well as the professional standards for clinical social work in gerontology, which emphasize person-centered care and the protection of vulnerable adults. An incorrect approach that involves immediately overriding the client's wishes based on a perceived risk, without a thorough assessment of capacity and underlying factors, fails to uphold the principle of client autonomy. This can lead to a paternalistic intervention that may alienate the client and undermine the therapeutic relationship. Such an approach could also violate regulations designed to protect the rights of older adults to make their own decisions, even if those decisions appear suboptimal to an external observer. Another incorrect approach, which is to dismiss the client's concerns as simply a manifestation of aging without further investigation, is ethically problematic and professionally negligent. This approach fails to acknowledge the individual's lived experience and potential for agency. It also risks overlooking treatable conditions or psychosocial stressors that may be contributing to the client's expressed desires. This disregard for the client's subjective experience and potential for underlying issues constitutes a failure to provide adequate care and could violate professional standards requiring thorough assessment. A further incorrect approach, which is to solely rely on family input without directly engaging the client in a capacity assessment, undermines the client's right to self-determination and confidentiality. While family can be a valuable source of information, the primary focus of assessment must remain on the individual client. Failing to prioritize the client's voice and direct assessment can lead to decisions that do not align with the client's actual needs or preferences, potentially causing distress and violating their rights. A professional decision-making process for similar situations should involve a systematic approach. 1. Establish rapport and a safe environment for open communication. 2. Conduct a thorough biopsychosocial spiritual assessment, paying close attention to cognitive function, emotional state, and any physical limitations impacting decision-making. 3. Explore the client's expressed wishes, understanding their rationale and any perceived benefits or drawbacks. 4. Assess decision-making capacity by evaluating the client's ability to understand the relevant information, appreciate the situation and its consequences, reason through options, and communicate a choice. 5. Consult with interdisciplinary team members, including physicians, nurses, and legal counsel if necessary, to gather diverse perspectives and ensure a holistic understanding. 6. Consider relevant legal and ethical guidelines, including those pertaining to informed consent, advance directives, and guardianship. 7. Develop an intervention plan collaboratively with the client, prioritizing their autonomy while ensuring their safety and well-being. Question 4. Performance analysis shows that a clinical social worker is assessing an older adult client experiencing significant social isolation, a decline in cognitive function, and increasing physical frailty. The social worker is considering which theoretical framework will best guide their intervention plan. Which of the following approaches demonstrates the most comprehensive and effective application of theories of aging for this client? Option A. Emphasizing activity theory to encourage the client to maintain high levels of social and physical activity without adequately considering the impact of their cognitive decline or physical limitations. Option B. Focusing exclusively on social disengagement theory to explain the client's isolation and assuming that addressing their social connections will resolve all presenting issues. Option C. Prioritizing a biopsychosocial model that integrates biological theories of cellular aging and neurodegeneration, psychological theories of cognitive decline and emotional regulation, and social theories of social support networks and environmental influences. Option D. Applying a purely biological perspective, attributing all of the client's difficulties solely to the inevitable physical deterioration associated with advanced age. The correct answer is C. Prioritizing a biopsychosocial model that integrates biological theories of cellular aging and neurodegeneration, psychological theories of cognitive decline and emotional regulation, and social theories of social support networks and environmental influences. Explanation. This scenario is professionally challenging because it requires the clinical social worker to integrate multiple theoretical perspectives on aging to accurately assess and intervene with an older adult client. The challenge lies in discerning which theoretical lens best explains the client's presenting issues and guides the most effective intervention, while also adhering to professional ethical standards and regulatory guidelines for gerontological practice. The correct approach represents best professional practice because it demonstrates a comprehensive understanding of the multifaceted nature of aging. By considering biological, psychological, and social theories, the clinician can develop a holistic assessment that acknowledges the interplay of physical changes, cognitive and emotional well-being, and environmental and interpersonal factors. This integrated approach allows for the identification of the root causes of the client's distress and the development of tailored interventions that address the client's unique needs and circumstances, aligning with the ethical imperative to promote client well-being and autonomy. Regulatory frameworks for clinical social work in gerontology emphasize evidence-based practice and person-centered care, which are best achieved through a multi-theoretical understanding of aging. An incorrect approach that focuses solely on biological theories might overlook the significant psychological and social determinants of the client's experience, leading to an incomplete assessment and potentially ineffective interventions. This would be a regulatory failure, as it deviates from the expectation of comprehensive client assessment. Another incorrect approach that prioritizes only social theories might neglect the impact of physiological decline on the client's functioning and emotional state, failing to address all contributing factors. This represents an ethical failure to provide holistic care, an approach that dismisses the relevance of any theoretical framework in favor of a purely intuitive response would be a significant professional and regulatory failure, as it lacks the grounding in established knowledge and evidence-based practice required by the profession. The professional decision-making process for similar situations should involve a systematic assessment that begins with gathering information from the client and their support system. This information should then be analyzed through the lens of various aging theories. The clinician should critically evaluate which theories best explain the observed phenomena and guide potential interventions. This involves considering the client's specific presentation, their history, and their environmental context. The chosen theoretical framework should then inform the development of a treatment plan that is both evidence-based and client-centered, with ongoing evaluation of its effectiveness. Adherence to professional codes of ethics and relevant regulatory guidelines is paramount throughout this process. Question 5. The performance metrics show a consistent trend of lower reported satisfaction scores from older adult clients who identify with specific ethnic minority groups, particularly when their primary language is not English. A clinical social worker is tasked with assessing a new 82-year-old client who recently immigrated from a rural region of Southeast Asia and speaks limited English, relying heavily on nonverbal cues and gestures. The social worker's primary language is English, and they have limited direct experience with this client's specific cultural background. What is the most culturally competent approach to conducting the initial assessment? Option A. Proceed with the assessment using simple English phrases and visual aids, assuming that basic needs and concerns can be universally understood and communicated. Option B. Utilize a professional, certified interpreter who is fluent in the client's native dialect and understands the cultural context of aging in their region to facilitate communication and gather information. Option C. Rely on the client's adult child, who is present and fluent in both English and their parents' language, to translate and convey the client's responses during the assessment. Option D. Focus the assessment primarily on observable behaviors and functional status, minimizing reliance on verbal communication to avoid potential misunderstandings due to language barriers. The correct answer is B. Utilize a professional, certified interpreter who is fluent in the client's native dialect and understands the cultural context of aging in their region to facilitate communication and gather information. Explanation. This scenario presents a common implementation challenge in gerontological clinical social work, ensuring cultural competence during assessment when faced with a client whose cultural background significantly differs from the clinician's own, and where direct translation may not fully capture nuanced meaning. The challenge lies in balancing the need for comprehensive assessment with the risk of misinterpretation or imposing a dominant cultural framework. Careful judgment is required to avoid ethnocentrism and to build trust, which is foundational for effective intervention. The correct approach represents best professional practice because it prioritizes a client-centered, culturally sensitive assessment. It acknowledges the limitations of direct translation and actively seeks to understand the client's lived experience within their cultural context. This aligns with the ethical principles of social work, particularly those emphasizing respect for the dignity and uniqueness of individuals and their cultures. It also reflects best practices in gerontological assessment, which require adaptability and a willingness to learn from the client. This approach is supported by the General Ethical Guidelines for Clinical Social Work, which mandate cultural competence and the avoidance of bias in assessment and intervention. An incorrect approach that relies solely on direct translation fails to account for the cultural nuances, idioms, and nonverbal communication that are integral to understanding a client's experience. This can lead to superficial or inaccurate assessments, potentially misdiagnosing issues or overlooking critical information. Ethically, this approach violates the principle of respecting client dignity and self-determination by not making adequate efforts to understand their perspective in their own terms. It can also be seen as a failure to provide competent services, as the assessment is compromised by a lack of cultural understanding. Another incorrect approach that assumes universal understanding of aging experiences, regardless of cultural background, is equally problematic. This ethnocentric perspective ignores the diverse ways in which aging is perceived and experienced across different cultures. It can lead to the imposition of Western-centric models of aging and well-being, which may not be relevant or appropriate for the client. This approach fails to meet the ethical obligation to provide culturally sensitive services and can result in interventions that are ineffective or even harmful. A third incorrect approach that avoids exploring cultural differences due to discomfort or perceived complexity bypasses a critical component of a comprehensive assessment. While navigating cultural differences can be challenging, avoiding them means failing to gather essential information that influences a client's needs, strengths, and preferences. This is a dereliction of professional duty, as it compromises the quality of the assessment and subsequent care planning. It also fails to uphold the ethical imperative to advocate for and serve vulnerable populations, which includes ensuring their cultural needs are met. The professional decision-making process for similar situations should involve a commitment to ongoing cultural self-awareness and education. When faced with a client from a different cultural background, the clinician should proactively consider potential cultural influences on their presentation and needs. This includes acknowledging their own potential biases and seeking to understand the client's cultural framework through open-ended questions, active listening, and a willingness to learn. If language barriers are significant, utilizing qualified interpreters who understand cultural context, rather than relying on family members or direct translation tools, is crucial. The process should prioritize building rapport and trust by demonstrating genuine respect for the client's cultural identity and experiences. Question 6. Analysis of how a clinical social worker in gerontology best evaluates an older adult client presenting with increased social withdrawal, decreased appetite, and reports of persistent fatigue, considering the interconnectedness of their physical health, emotional state, and environmental circumstances. Option A. Concentrate on assessing the client's reported feelings of sadness and hopelessness, assuming these psychological symptoms are the sole cause of their behavioral changes and physical complaints. Option B. Conduct a thorough biopsychosocial assessment, exploring the client's current physical health conditions and medications, their mood and cognitive functioning, and their social support network and living situation, to identify potential contributing factors across all domains. Option C. Prioritize an evaluation of the client's social isolation and lack of community engagement, attributing the withdrawal and fatigue to these external factors without exploring internal psychological or biological influences. Option D. Focus primarily on the client's recent medical history and prescribed medications, assuming that fatigue and appetite changes are solely indicative of underlying physical ailments. The correct answer is B. Conduct a thorough biopsychosocial assessment, exploring the client's current physical health conditions and medications, their mood and cognitive functioning, and their social support network and living situation, to identify potential contributing factors across all domains. Explanation. This scenario presents a professional challenge due to the complex interplay of biological, psychological, and social factors influencing an older adult's well-being, requiring a holistic assessment that goes beyond a single domain. The challenge lies in accurately identifying the primary drivers of the client's distress and formulating an intervention plan that addresses all contributing elements, not just the most apparent. The correct approach represents best professional practice because it aligns with the core principles of gerontological social work, emphasizing a person and environment perspective. This approach necessitates a comprehensive evaluation that considers the client's physical health status, biological, their emotional state and cognitive functioning, psychological, and their family dynamics, community support, and socioeconomic conditions, social. Such an integrated assessment is crucial for developing effective, individualized interventions that promote autonomy, dignity, and quality of life for older adults, as mandated by ethical guidelines that promote client well-being and self-determination. An incorrect approach that focuses solely on the biological aspects, such as attributing all symptoms to age-related physical decline, fails to acknowledge the significant impact of psychological distress, e.g., depression, anxiety, or social isolation on an individual's overall health and functioning. This narrow focus can lead to misdiagnosis and ineffective treatment, potentially exacerbating the client's suffering and violating ethical obligations to provide comprehensive care. Another incorrect approach that prioritizes only psychological factors, such as solely addressing perceived anxiety, without considering underlying physical pain or social stressors, overlooks critical biological and social determinants of mental health in older adults. This can result in superficial interventions that do not resolve the root causes of distress. An approach that exclusively examines social determinants, such as focusing only on financial assistance without addressing the client's physical pain or emotional withdrawal, also represents a failure to provide holistic care. While social factors are vital, ignoring biological and psychological needs can lead to incomplete and ultimately ineffective support. Professionals should employ a decision-making framework that begins with a broad biopsychosocial assessment. This involves active listening, open-ended questioning, and the use of validated assessment tools that cover physical health, mental health, and social support systems. The process should involve collaboration with the client and, with consent, with family members or other healthcare providers to gather a complete picture. Interventions should then be tailored to address the identified needs across all three domains, with ongoing evaluation and adjustment based on the client's response and evolving circumstances. This systematic, integrated approach ensures that interventions are evidence-based, client-centered, and ethically sound. Question 7. The control framework reveals that a clinical social worker is assessing an 85-year-old client experiencing increasing forgetfulness, social withdrawal, and expressions of sadness. The client lives alone and has limited family contact. The social worker needs to determine the most appropriate next steps to address the client's psychological well-being. Which approach best guides the social worker's decision-making process in this situation? Option A. Conduct a comprehensive impact assessment of potential interventions on the client's cognitive function, emotional state, social engagement, and overall quality of life, while prioritizing the client's expressed wishes and autonomy. Option B. Prioritize the wishes of the client's estranged adult child, who expresses concern about the client's memory, even if it means overriding the client's stated desire to remain independent. Option C. Immediately recommend placement in an assisted living facility to ensure the client's safety and provide structured social interaction, assuming cognitive decline necessitates such a move. Option D. Focus solely on prescribing or referring for psychotropic medication to address the client's sadness, without a thorough evaluation of the underlying causes or impact on cognitive function. The correct answer is A. Conduct a comprehensive impact assessment of potential interventions on the client's cognitive function, emotional state, social engagement, and overall quality of life, while prioritizing the client's expressed wishes and autonomy. Explanation: this scenario is professionally challenging due to the inherent vulnerability of older adults experiencing cognitive decline and mental health issues. The social worker must balance the client's autonomy with the need for safety and appropriate care, navigating complex ethical considerations and regulatory requirements. The impact assessment approach is crucial for systematically evaluating the potential consequences of different interventions on the client's well-being, dignity, and rights. The correct approach represents best professional practice because it prioritizes a comprehensive and individualized assessment of the client's psychological state, functional capacity, and support system. This aligns with the ethical principles of beneficence, non-maleficence, and respect for autonomy, as well as regulatory mandates for person-centered care and evidence-based practice in gerontology. A thorough impact assessment ensures that interventions are tailored to the client's specific needs and circumstances, minimizing potential harm and maximizing positive outcomes. An incorrect approach that focuses solely on immediate symptom management, without considering the broader psychological and social impact, fails to address the underlying causes of distress and may lead to a superficial or ineffective intervention. This could violate ethical obligations to promote the client's overall well-being and potentially contravene regulations requiring holistic care planning. Another incorrect approach that overemphasizes family wishes without adequately assessing the client's own preferences and capacity for decision-making disregards the principle of client self-determination. This can lead to interventions that are not aligned with the client's values or goals, potentially causing resentment and undermining the therapeutic relationship. Regulatory frameworks typically emphasize client consent and participation in care planning. An approach that relies on generalized assumptions about aging and cognitive decline, rather than conducting a specific impact assessment for the individual, risks stereotyping and misdiagnosis. This can result in inappropriate interventions that do not meet the client's unique needs and may even exacerbate their condition. Ethical guidelines and professional standards demand individualized assessment and intervention. The professional decision-making process for similar situations should involve 1. Conducting a thorough biopsychosocial spiritual assessment with a specific focus on cognitive status and mental health symptoms. 2. Engaging the client in a collaborative discussion about their concerns, goals, and preferences, respecting their capacity for decision-making. 3. Identifying potential interventions and systematically assessing the likely impact of each on the client's well-being, autonomy, and safety. 4. Consulting with supervisors, interdisciplinary team members, and relevant ethical guidelines or regulations as needed. 5. Developing a care plan that is individualized, evidence-informed, and responsive to the client's evolving needs. Question 8. The evaluation methodology shows that an 82-year-old client presents with recent onset of fluctuating confusion, disorientation, and visual hallucinations, alongside a history of progressive memory loss and a persistent low mood. The clinical social worker must determine the primary presenting syndrome to guide intervention. Which of the following assessment strategies best addresses the complexity of this presentation? Option A. Initiate immediate antidepressant therapy to address the client's low mood, as depression is a common cause of cognitive complaints in older adults, and observe for changes in confusion. Option B. Conduct a differential diagnostic process that systematically evaluates for dementia, delirium, and depression, utilizing a combination of standardized assessments, collateral information, and direct observation of the client's fluctuating mental status and mood. Option C. Prioritize a comprehensive cognitive assessment to definitively diagnose dementia, given the client's age and reported memory loss, and then address other symptoms as secondary. Option D. Focus on a thorough medical workup to rule out acute causes of confusion and delirium, such as infection or medication side effects, before considering other diagnoses. The correct answer is C. Prioritize a comprehensive cognitive assessment to definitively diagnose dementia, given the client's age and reported memory loss, and then address other symptoms as secondary. Explanation. This scenario presents a common challenge in geriatric clinical social work, differentiating between overlapping geriatric syndromes, specifically dementia, delirium, and depression, when a client exhibits a constellation of symptoms. The professional's responsibility is to conduct a thorough, client-centered assessment that respects the client's autonomy and dignity, while adhering to ethical principles and professional standards of practice. The challenge lies in the potential for misdiagnosis, which can lead to inappropriate interventions, unnecessary distress for the client and family, and a failure to address the underlying causes of the client's presentation. The correct approach prioritizes a comprehensive, multifaceted assessment that integrates subjective reports, objective observations, and collateral information, while systematically ruling out or confirming each potential diagnosis. This aligns with the ethical imperative to provide competent and evidence-based care, ensuring that interventions are tailored to the client's specific needs and conditions. It also reflects the professional standard of care in gerontology, which demands a nuanced understanding of the interplay between cognitive, emotional, and physiological factors in older adults. An incorrect approach would involve prematurely concluding a diagnosis based on limited information or a single symptom, neglecting to explore contributing factors, or failing to involve the client and their support system in the diagnostic process. Such approaches risk misattribution of symptoms, leading to ineffective or even harmful treatment plans. For instance, attributing all cognitive changes solely to dementia without considering the possibility of reversible causes like delirium or depression is a significant ethical and professional failing. This can result in a failure to provide necessary medical or psychiatric treatment for conditions that are treatable, thereby violating the principle of beneficence and non-maleficence. Furthermore, failing to obtain informed consent for assessment or to involve the client in decision-making processes, where appropriate, infringes upon their right to self-determination. The professional decision-making process in such situations should involve a systematic approach. 1. Gather comprehensive information from multiple sources: client, family, medical records, previous assessments. 2. Conduct a thorough biopsychosocial spiritual assessment, paying close attention to cognitive function, mood, and recent changes in mental status. 3. Utilize validated assessment tools for dementia, delirium, and depression, but do not rely solely on them. 4. consider differential diagnoses and actively seek to rule out reversible causes of cognitive and behavioral changes. 5. Collaborate with other healthcare professionals, physicians, nurses, psychiatrists, to ensure a holistic understanding of the client's condition. 6. Engage the client and their family in discussions about findings and potential treatment options, respecting their values and preferences. 7. Document the assessment process, findings, and rationale for diagnostic conclusions meticulously. Question 9. Research into the effectiveness of psychosocial interventions for older adults with mild cognitive impairment suggests that participation in peer support groups can be beneficial. A 78-year-old client who has been diagnosed with mild cognitive impairment expresses a strong desire to join a support group for individuals experiencing age-related changes. The client states, "I want to talk to people who understand what I'm going through." However, the social worker notes that the client occasionally struggles to recall recent events and sometimes misinterprets questions. What is the most ethically and professionally sound approach for the social worker to take? Option A. Inform the client's adult children about their desire to join the support group and seek their input on whether it would be appropriate, without further assessing the client's capacity. Option B. Advise the client that due to their mild cognitive impairment, participation in a support group may be too overwhelming and suggest alternative solitary activities. Option C. Immediately enroll the client in the support group, as their expressed desire to connect with peers is the primary indicator of their readiness and potential benefit. Option D. Conduct a thorough assessment of the client's capacity to understand the purpose, benefits, and potential challenges of participating in the support group, considering their current cognitive status and ability to make informed decisions. The correct answer is D. Conduct a thorough assessment of the client's capacity to understand the purpose, benefits, and potential challenges of participating in the support group, considering their current cognitive status and ability to make informed decisions. Explanation. This scenario presents a common challenge in gerontological social work, balancing the desire to empower older adults with the need to ensure their safety and well-being, particularly when cognitive impairment is a factor. The professional must navigate the client's expressed wishes against potential risks, adhering to ethical principles of self-determination, while also upholding the duty of care. The complexity arises from the subtle nature of cognitive decline and the difficulty in definitively assessing capacity for decision-making. The correct approach represents best professional practice by prioritizing a comprehensive, individualized assessment of the client's capacity to understand the risks and benefits of participating in a support group. This aligns with ethical guidelines that mandate respecting client autonomy while also ensuring safety. Specifically, it involves a multifaceted evaluation that considers the client's cognitive state, their understanding of the group's purpose and potential impact, and their ability to articulate reasons for their decision. This approach is grounded in the principle of informed consent, which requires not just agreement but also comprehension. Regulatory frameworks for clinical social work emphasize the importance of client self-determination, but this right is not absolute and can be limited when a client lacks the capacity to make decisions that could lead to significant harm. An incorrect approach that focuses solely on the client's expressed desire to join the group without a thorough capacity assessment fails to uphold the duty of care. This could lead to the client experiencing undue distress or harm if they are unable to process the group's content, or if the group environment is not suitable for their current cognitive functioning. This approach violates ethical principles by potentially placing the client in a vulnerable situation without adequate safeguards. Another incorrect approach that immediately denies the client participation based on a generalized assumption of cognitive impairment, without a specific assessment, is discriminatory and violates the principle of self-determination. This approach fails to recognize that cognitive impairment exists on a spectrum, and that many individuals with mild impairment can still benefit from and participate meaningfully in support groups. It also overlooks the potential therapeutic benefits of social connection and peer support for older adults. A further incorrect approach that involves informing the client's family without their consent, unless there is a clear and imminent risk of harm that the client cannot mitigate, breaches confidentiality and erodes trust. While family involvement can be beneficial, it must be approached ethically, respecting the client's privacy and autonomy as much as possible. Regulatory standards for social work strictly define the conditions under which confidentiality can be breached, and a generalized concern about cognitive decline is typically insufficient justification without a more concrete assessment of risk. The professional decision-making process for similar situations should involve a systematic evaluation of the client's capacity. This includes 1. Assessing the client's understanding of the specific decision at hand, e.g., joining a support group. 2. Evaluating their ability to appreciate the relevant information and its consequences. 3. Examining their ability to reason through the options. And 4. Considering their ability to communicate a choice. If capacity is questionable, the social worker should employ strategies to enhance understanding, such as simplifying information, using visual aids, or involving a trusted intermediary, before concluding that the client lacks capacity. Consultation with supervisors or interdisciplinary team members is also a crucial step when complex ethical or capacity issues arise. Question 10. System analysis indicates that a clinical social worker is participating in a comprehensive geriatric assessment, CGA, for an 85-year-old client experiencing multiple chronic conditions and significant functional decline. The social worker's primary responsibility within the CGA team is to evaluate the client's psychosocial well-being, social support system, home environment, and access to community resources. During the assessment, the social worker identifies significant social isolation, a lack of adequate caregiver support, and potential safety hazards in the client's home. The social worker also notes the client's expressed desire to remain independent in their own home. Which of the following approaches best reflects the social worker's role in synthesizing this information for the CGA and contributing to the care plan? Option A. Prioritize the psychosocial and environmental findings, integrating them with the medical and functional data from other team members to identify specific interventions that support the client's goal of remaining at home, while advocating for necessary community resources and caregiver support. Option B. Focus exclusively on documenting the extent of the client's social isolation and home safety hazards in a detailed report, leaving the integration of this information and the development of interventions to the physician and other team members. Option C. Conduct an extensive interview with the client's extended family to gather more historical data, delaying the synthesis of current findings until all potential family input has been received, and then present a comprehensive psychosocial history without specific recommendations for immediate action. Option D. Delegate the assessment of home safety hazards to the occupational therapist and the evaluation of social support to a community case manager, focusing solely on the client's emotional state and coping mechanisms without explicitly linking these to environmental or support system factors. The correct answer is A. Prioritize the psychosocial and environmental findings, integrating them with the medical and functional data from other team members to identify specific interventions that support the client's goal of remaining at home, while advocating for necessary community resources and caregiver support. Explanation. Scenario analysis. This scenario presents a common implementation challenge in comprehensive geriatric assessment, CGA, within the context of clinical social work in gerontology. The core difficulty lies in balancing the holistic, interdisciplinary nature of CGA with the practical constraints of time, resources, and the need for efficient documentation. The social worker must navigate the ethical imperative to provide thorough assessment with the reality of service delivery, ensuring that the assessment is both comprehensive and actionable without becoming overly burdensome or delaying necessary interventions. The challenge is amplified by the potential for differing professional priorities and communication styles within an interdisciplinary team. Correct approach analysis. The correct approach emphasizes the social worker's role in synthesizing information from various domains of the CGA, particularly focusing on psychosocial, environmental, and functional aspects that directly impact the older adult's well-being and ability to access services. This approach aligns with the ethical principles of client advocacy and self-determination, ensuring that the older adult's unique needs and preferences are central to the assessment. It also reflects best professional practice by prioritizing the identification of barriers to care and the development of a coordinated, client-centered care plan. Regulatory frameworks for clinical social work in gerontology typically mandate a holistic assessment that considers the individual within their environment, and this approach directly addresses that requirement by integrating social determinants of health into the CGA. Incorrect approaches analysis. One incorrect approach might involve focusing solely on the older adult's medical history and current physical health status, neglecting the crucial psychosocial, environmental, and functional dimensions that are central to a social worker's expertise and the comprehensive nature of CGA. This failure to address the social determinants of health would violate ethical guidelines that require a holistic understanding of the client and could lead to an incomplete or ineffective care plan. It also fails to leverage the unique contribution of social work to the interdisciplinary team. Another incorrect approach could be to delegate the psychosocial and environmental assessment components entirely to other disciplines without ensuring adequate integration or follow-up. This would represent a failure to uphold the social worker's professional responsibilities within the CGA process, potentially leaving critical needs unaddressed or misunderstood. It also undermines the collaborative spirit of CGA and could lead to fragmented care. A third incorrect approach might be to conduct an overly lengthy and detailed psychosocial assessment that, while thorough in isolation, is not effectively integrated into the broader CGA or translated into actionable recommendations for the interdisciplinary team. This could lead to assessment paralysis, delaying the development of a cohesive care plan and potentially overwhelming the older adult and their caregivers with information that is not immediately relevant to their pressing needs. This approach fails to meet the practical demands of interdisciplinary collaboration and efficient service delivery. Professional reasoning. Professionals should approach CGA by first understanding the specific goals of the assessment and the older adult's immediate concerns. They should then identify their unique contribution to the interdisciplinary team, focusing on areas where their expertise is most critical, e.g., psychosocial functioning, social support, environmental safety, access to resources. Effective communication and collaboration with other team members are paramount. Professionals should strive to synthesize their findings with those of other disciplines to create a unified understanding of the older adult's situation and a cohesive, client-centered care plan. Documentation should be clear, concise, and focused on actionable recommendations that directly inform the care plan. Question 11. Cost-benefit analysis shows that allowing an elderly client with a history of falls and cognitive fluctuations to remain in their home independently, despite their expressed desire to do so, presents a significant risk of injury and increased future care costs for their family. The client, however, insists they are capable and refuse any external support or alternative living arrangements. What is the most ethically and legally sound course of action for the clinical social worker? Option A. Immediately contact Adult Protective Services and the client's physician to arrange for involuntary relocation to an assisted living facility, citing the potential for future harm and cost savings. Option B. Initiate a formal capacity assessment to determine the client's ability to make decisions about their living situation, while simultaneously exploring with the client and their family potential safety measures and support services that could enable them to remain at home safely, respecting their autonomy as much as possible. Option C. Focus on documenting the family's concerns about future costs and the client's resistance to support, as this information is crucial for justifying the need for external intervention to the facility where the client might eventually reside. Option D. Advise the client that their cognitive fluctuations and fall history make them incapable of safe, independent living, and strongly recommend they move to a supervised facility without further assessment of their current capacity. The correct answer is B. Initiate a formal capacity assessment to determine the client's ability to make decisions about their living situation, while simultaneously exploring with the client and their family potential safety measures and support services that could enable them to remain at home safely, respecting their autonomy as much as possible. Explanation. This scenario presents a professional challenge due to the inherent conflict between a client's expressed wishes and the social worker's assessment of potential harm, compounded by the complexities of capacity and the legal framework surrounding elder care. The social worker must navigate the client's autonomy, the duty to protect, and the legal requirements for intervention, all within the specific regulatory landscape of the CSWG exam's jurisdiction. The correct approach prioritizes a thorough, documented assessment of the client's capacity to make decisions regarding their living situation, engaging in a collaborative process with the client to explore their concerns, and the risks associated with their preferred choice. This aligns with ethical principles of client self-determination, while also upholding the professional responsibility to ensure safety and well-being. It also adheres to legal mandates that require evidence of diminished capacity before overriding a client's wishes, and emphasizes least restrictive interventions. This approach involves exploring alternatives, providing resources, and ensuring the client understands the potential consequences of their decision, all while maintaining professional boundaries and respecting the client's dignity. An incorrect approach that immediately involves external authorities without a comprehensive capacity assessment fails to respect the client's autonomy and may constitute an unwarranted intrusion. This could violate ethical guidelines that mandate exploring all less intrusive options first, and could have legal repercussions if the client is later found to have capacity. Another incorrect approach that dismisses the client's concerns due to their age or perceived vulnerability, without a proper assessment, is discriminatory and unethical. This violates principles of respect and dignity, and ignores the legal requirement to assess capacity individually. Finally, an approach that focuses solely on the perceived financial or logistical cost-benefit for the family or facility, rather than the client's well-being and rights, is a gross ethical and legal failing. This prioritizes external interest over the client's best interests and disregards the professional's primary duty of care. Professionals should employ a decision-making process that begins with a comprehensive assessment of the client's current situation, including their physical, cognitive, and psychosocial functioning. This assessment must specifically address the client's capacity to understand the information relevant to their decision and to appreciate the consequences of their choices. If capacity is in question, a formal capacity assessment should be conducted, adhering to jurisdictional guidelines. Throughout this process, open communication with the client is paramount, exploring their preferences, values, and concerns. Collaboration with the client to identify potential risks and develop strategies to mitigate them is essential. If, after thorough assessment and exploration of alternatives, there remains a significant risk of harm, and the client lacks capacity to make a safe decision, then consultation with supervisors, legal counsel, and appropriate authorities, following established protocols, becomes necessary. Question 12. Which approach would be most appropriate for a clinical social worker in gerontology to address medication management and adherence challenges for an older adult client experiencing mild cognitive impairment who expresses a desire to manage their own medications but has a history of missed doses? Option A. Advise the client to stop taking certain medications that they report as causing side effects without consulting their physician. Option B. Implement direct supervision of the client's medication intake at all times to ensure all doses are taken as prescribed, given their history of missed doses. Option C. Immediately recommend a full-time caregiver to manage all of the client's medications, overriding the client's stated desire to manage them independently. Option D. Conduct a comprehensive assessment of the client's cognitive capacity, medication understanding, and potential barriers to adherence. Then collaborate with the client, their family, and the healthcare team to develop a tailored medication management plan that explores various adherence strategies. The correct answer is D. Conduct a comprehensive assessment of the client's cognitive capacity, medication understanding, and potential barriers to adherence. Then collaborate with the client, their family, and the healthcare team to develop a tailored medication management plan that explores various adherence strategies. Explanation. This scenario presents a common challenge in gerontological social work, ensuring medication adherence for an older adult with cognitive impairment while respecting their autonomy and privacy. The professional must balance the client's right to self-determination with the ethical and legal imperative to ensure their safety and well-being, particularly when cognitive deficits may impair judgment regarding medication. The correct approach prioritizes a comprehensive, client-centered assessment that involves the client, their family or caregivers, and their healthcare team. This collaborative strategy aligns with ethical principles of beneficence, acting in the client's best interest, and autonomy, respecting their choices to the extent possible. It also adheres to regulatory frameworks that emphasize interdisciplinary collaboration and person-centered care planning. By involving all relevant parties and exploring various adherence strategies tailored to the client's specific needs and cognitive abilities, the social worker promotes safety and efficacy while respecting the client's dignity. This approach is grounded in the understanding that medication management is a complex issue requiring a multifaceted solution. An incorrect approach that solely relies on direct supervision, without exploring less restrictive options, fails to adequately assess the client's capacity and may infringe upon their privacy and autonomy unnecessarily. This could violate ethical guidelines regarding least restrictive interventions and may not be supported by regulations that promote client independence. Another incorrect approach that involves unilaterally altering the medication regimen without consulting the healthcare provider or the client/family disregards the expertise of the medical team and the client's right to be informed and involved in their care decisions, potentially leading to adverse health outcomes and violating professional standards of practice. Finally, an approach that dismisses the client's concerns about medication side effects without further investigation or consultation with the healthcare provider fails to address potential barriers to adherence and demonstrates a lack of empathy and a failure to engage in a therapeutic alliance, which is crucial for effective intervention. Professionals should employ a decision-making process that begins with a thorough assessment of the client's cognitive status, understanding of their medication, and any identified barriers to adherence. This assessment should inform a collaborative care plan developed with the client, family, and healthcare providers. The plan should explore a range of evidence-based strategies, from simplified medication schedules and pill organizers to educational interventions and technological aids, always prioritizing the least intrusive and most empowering options. Regular reassessment and adjustment of the plan are essential to ensure ongoing effectiveness and client well-being. Question 13. The review process indicates that a clinical social worker is assessing an older adult client presenting with symptoms suggestive of depression and anxiety. The client has a history of multiple chronic medical conditions and lives alone in a community setting. Which of the following approaches best reflects best professional practice in this complex situation? Option A. Focus exclusively on psychoeducation about the aging process and coping mechanisms for life transitions, without a thorough assessment of underlying mood and anxiety disorders. Option B. Recommend immediate enrollment in a day program for seniors, without a detailed assessment of the client's specific mental health needs or preferences for intervention. Option C. Prioritize a referral for a psychiatric evaluation solely for medication management, assuming that the client's symptoms are primarily a result of their chronic medical conditions and age-related changes. Option D. Conduct a comprehensive biopsychosocial assessment, integrating information about the client's medical status, cognitive function, social support, environmental factors, and personal history, to inform a collaborative treatment plan that may include psychotherapy, medication management referrals, and community resource linkage. The correct answer is D. Conduct a comprehensive biopsychosocial assessment, integrating information about the client's medical status, cognitive function, social support, environmental factors, and personal history, to inform a collaborative treatment plan that may include psychotherapy, medication management referrals, and community resource linkage. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the clinical social worker to navigate the complexities of diagnosing and treating depression and anxiety in an older adult, while also considering the unique biopsychosocial factors that impact this population. The challenge lies in differentiating between age-related changes, co-occurring medical conditions, and primary mental health disorders, and in selecting interventions that are both effective and appropriate for the client's developmental stage and potential physical limitations. The social worker must also be mindful of potential stigma associated with mental health in older adults and ensure a client-centered, culturally sensitive approach. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, holistic assessment that integrates biological, psychological, and social factors. This aligns with the core principles of clinical social work and the specific ethical guidelines for working with older adults, which emphasize understanding the individual within their environment and addressing all contributing factors to well-being. This approach ensures that the diagnosis is accurate and that the treatment plan is tailored to the client's specific needs, promoting optimal outcomes and respecting their autonomy and dignity. It also implicitly adheres to regulatory frameworks that mandate evidence-based practice and client-centered care. Incorrect approaches analysis. An approach that focuses solely on a single modality without considering the interplay of other factors is professionally unacceptable. For example, a purely pharmacological approach without a thorough psychosocial assessment overlooks the significant impact of social isolation, grief, or environmental stressors on depression and anxiety in older adults. This fails to meet the standard of comprehensive care and may lead to ineffective treatment or adverse side effects. Another incorrect approach would be to dismiss symptoms as normal aging. This is a significant ethical and professional failure, as it can lead to untreated mental health conditions, causing unnecessary suffering and decline in quality of life. Regulatory frameworks and ethical codes for clinical social work explicitly prohibit such dismissive attitudes and mandate the diligent assessment and treatment of mental health concerns in all age groups, including older adults. Finally, an approach that does not involve the client in treatment planning or fails to consider their preferences and values is ethically unsound. Best practice dictates shared decision-making, ensuring that interventions are not only clinically appropriate, but also aligned with the client's goals and life circumstances. Failure to do so can result in non-adherence and a breakdown of the therapeutic alliance. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough, multidimensional assessment. This involves gathering information from the client, family, with consent, and medical records, and considering the client's history, current functioning, and environmental context. Following assessment, the professional should identify potential diagnoses and differential diagnoses, considering all contributing factors. Treatment planning should be collaborative, evidence-based, and tailored to the individual's needs and preferences. Ongoing evaluation of treatment effectiveness and client progress is crucial, with adjustments made as necessary. This process ensures ethical practice, adherence to regulatory requirements, and the delivery of high-quality, client-centered care. Question 14. The analysis reveals that a 78-year-old client presents with increased social withdrawal, loss of interest in previously enjoyed activities, and frequent complaints of fatigue and aches. The client's adult children express concern that their parent is just getting old, and that these changes are to be expected. What is the most appropriate initial clinical social work approach to address these concerns within the context of geriatric mental health? Option A. Directly address the family's perception that the symptoms are just getting old and challenge their assumptions about normal aging. Option B. Conduct a comprehensive biopsychosocial assessment, including screening for common geriatric mental health disorders such as depression and anxiety, and exploring potential contributing factors like chronic illness, medication side effects, and social isolation. Option C. Reassure the client and their family that these symptoms are typical for aging and focus on providing supportive counseling for adjustment to later life. Option D. Recommend a referral to a primary care physician solely for a physical examination, assuming all symptoms are medically related. The correct answer is B. Conduct a comprehensive biopsychosocial assessment, including screening for common geriatric mental health disorders such as depression and anxiety, and exploring potential contributing factors like chronic illness, medication side effects, and social isolation. Explanation. This scenario is professionally challenging due to the complex interplay of age-related changes, co-occurring physical health conditions, and the potential for stigma surrounding mental health in older adults. Accurately identifying and differentiating between common mental health disorders in gerontology requires a nuanced understanding of their presentation, which can differ significantly from younger populations. Furthermore, the impact of social determinants of health, such as isolation and financial strain, on mental well-being in this demographic necessitates a holistic assessment. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment that considers the unique biopsychosocial factors influencing geriatric mental health. This aligns with the ethical imperative to provide client-centered care and the regulatory framework that mandates competent and ethical practice in specialized areas like gerontology. It acknowledges the prevalence of conditions such as depression, anxiety, and cognitive impairment, and the need for differential diagnosis to ensure appropriate intervention. An incorrect approach that focuses solely on observable behaviors without exploring underlying emotional or cognitive states fails to meet the standard of care. This could lead to misdiagnosis and ineffective treatment, potentially exacerbating the individual's distress. Ethically, It violates the principle of beneficence by not acting in the client's best interest. From a regulatory standpoint, it may fall short of the competency requirements for clinical social work practice in gerontology, which demands a thorough understanding of geriatric mental health presentations. Another incorrect approach that dismisses reported symptoms as simply a normal part of aging is also professionally unacceptable. This overlooks the treatable nature of many mental health conditions in older adults and can result in significant suffering and functional decline. It is a failure to adhere to the principle of non-maleficence by allowing harm to persist. Regulatory bodies expect practitioners to advocate for the well-being of their clients and to challenge ageist assumptions that can impede access to care. A third incorrect approach that relies on anecdotal evidence or stereotypes about older adults' mental health is ethically unsound and professionally negligent. This approach lacks objectivity and can perpetuate harmful biases. It fails to uphold the professional responsibility to engage in objective assessment and evidence-based practice, which are cornerstones of ethical and regulatory compliance in clinical social work. Professionals should employ a decision-making framework that begins with a thorough understanding of the prevalence and varied presentations of mental health disorders in geriatric populations. This involves active listening, collateral information gathering with consent, and utilizing validated assessment tools. The process should then involve differential diagnosis, considering both mental health conditions and their overlap with physical health issues. Finally, treatment planning should be individualized, evidence-based, and culturally sensitive, with ongoing evaluation of progress and adjustment of interventions as needed. This systematic approach ensures adherence to ethical principles and regulatory requirements. Question 15. Risk assessment procedures indicate that an 85-year-old client who lives independently has recently expressed a strong desire to stop taking prescribed medications for a chronic health condition, citing a belief that they are no longer effective and are causing side effects. The client's adult children are highly concerned about this decision, fearing a significant decline in their parents' health and potential hospitalization. The clinical social worker notes that the client appears alert and can articulate their reasoning, but also observes some mild forgetfulness in recent conversations. What is the most appropriate course of action for the clinical social worker? Option A. Focus solely on addressing the family's anxieties and concerns, reassuring them that they will monitor the situation closely and intervene if the client's health deteriorates significantly. Without directly engaging the client in a capacity assessment. Option B. Immediately inform the client that their decision is unsafe and work with the family to implement a plan to ensure the client continues taking their medications, overriding the client's expressed wishes. Option C. Conduct a comprehensive assessment of the client's decision-making capacity regarding their medication regimen, exploring their understanding of the condition, the purpose of the medications, potential risks of discontinuation, and any reversible factors contributing to their current beliefs, while also exploring less restrictive alternatives to complete cessation. Option D. Advise the client to continue taking their medications as prescribed, based on the family's concerns and the potential for health decline, without conducting a formal assessment of their capacity to make this decision. The correct answer is C. Conduct a comprehensive assessment of the client's decision-making capacity regarding their medication regimen, exploring their understanding of the condition, the purpose of the medications, potential risks of discontinuation, and any reversible factors contributing to their current beliefs, while also exploring less restrictive alternatives to complete cessation. Explanation. This scenario presents a common yet complex challenge in gerontological clinical social work, balancing an older adult's expressed desire for autonomy with potential risks to their safety and well-being, particularly when cognitive changes are suspected. The professional must navigate the ethical imperative to respect self-determination while fulfilling the duty of care, all within the specific regulatory and ethical guidelines governing clinical social work practice in gerontology. The challenge lies in accurately assessing the degree of cognitive impairment, understanding its impact on decision-making capacity, and determining the least restrictive intervention that ensures safety. The correct approach prioritizes a comprehensive, person-centered assessment of decision-making capacity. This involves evaluating the individual's understanding of their situation, the risks and benefits of their choices, and their ability to communicate a choice. It also necessitates exploring the underlying reasons for their expressed wishes and identifying any reversible factors contributing to potential impairment. This approach aligns with ethical principles of autonomy, beneficence, and non-maleficence, and is supported by regulatory frameworks that mandate client self-determination unless capacity is demonstrably lacking. Best professional practice dictates a thorough, documented assessment of capacity before overriding an individual's choices and exploring less restrictive alternatives first. An incorrect approach would be to immediately override the client's wishes based solely on the family's concerns or the professional's initial impression of risk. This fails to uphold the client's right to self-determination and may constitute a violation of their autonomy. Another incorrect approach would be to solely rely on the family's interpretation of the situation without conducting an independent assessment of the client's capacity. This neglects the professional's direct responsibility to the client and may lead to interventions that are not in the client's best interest or are not legally or ethically justified. Failing to document the assessment process, the rationale for decisions, and the exploration of alternatives would also represent a significant regulatory and ethical failure, hindering accountability and potentially exposing the professional to liability. The professional decision-making process in such situations should involve a systematic approach. 1. Acknowledge and validate the client's expressed wishes and concerns. 2. Conduct a thorough, multifaceted assessment of cognitive function and decision-making capacity, considering all relevant factors. 3. Engage in open communication with the client, family, and other relevant parties while maintaining client confidentiality. 4. Explore all possible interventions, starting with the least restrictive options that can mitigate identified risks. 5. Document all assessments, interventions, and decisions meticulously, with clear justification. 6. Consult with supervisors or ethics committees when facing complex ethical dilemmas. Question 16. The risk matrix shows a client diagnosed with Alzheimer's disease who has recently made several unusual financial transactions, including large cash withdrawals and the purchase of expensive, unnecessary items. The client's adult children express significant concern about their parents' financial management and potential exploitation. As a clinical social worker in gerontology, what is the most appropriate initial course of action to address these concerns while adhering to professional and regulatory standards? Option A. Rely on the client's verbal assurances that they are managing their finances appropriately and dismiss the family's concerns, as the client has the right to self-determination. Option B. Conduct a comprehensive functional assessment of the client's capacity to manage finances, gathering information from the client, family, and medical records, and exploring less restrictive interventions before considering formal legal actions. Option C. Immediately report the situation to Adult Protective Services and recommend the initiation of guardianship proceedings to protect the client's assets. Option D. Advise the family to take over all financial management for the client to prevent further losses, as the diagnosis of Alzheimer's disease indicates a loss of capacity. The correct answer is B. Conduct a comprehensive functional assessment of the client's capacity to manage finances, gathering information from the client, family, and medical records, and exploring less restrictive interventions before considering formal legal actions. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a client with a cognitive disorder, specifically Alzheimer's disease, who is exhibiting behaviors that may indicate a decline in their ability to manage their finances. The social worker must balance the client's right to self-determination with the need to protect them from potential exploitation or financial harm. The complexity arises from assessing the client's capacity, respecting their autonomy, and navigating the legal and ethical obligations to report or intervene when capacity is compromised, all within the specific regulatory framework governing clinical social work in gerontology. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, client-centered assessment of capacity. This involves gathering information from multiple sources, including the client, family, and medical professionals, and utilizing standardized assessment tools where appropriate. The focus is on understanding the *specific cognitive deficits and how they impact financial decision-making, rather than making assumptions based solely on the diagnosis. This aligns with ethical principles of beneficence and non-maleficence, ensuring the client's well-being while respecting their dignity and autonomy. Furthermore, It adheres to regulatory requirements that mandate a thorough assessment of capacity before any intervention that might infringe upon a client's rights, such as initiating guardianship proceedings or reporting to adult protective services. The approach emphasizes collaboration and least restrictive interventions, seeking to empower the client to maintain as much control as possible. Incorrect approaches analysis. One incorrect approach involves immediately reporting concerns to adult protective services or initiating guardianship proceedings based solely on the diagnosis of Alzheimer's disease and the family's expressed concerns. This fails to meet the regulatory and ethical requirement for an individualized assessment of capacity. A diagnosis alone does not automatically equate to a complete loss of capacity. Such an immediate action could be an overreach, violating the client's right to self-determination and potentially causing unnecessary distress and legal complications. It bypasses the crucial step of determining the degree and nature of the client's impairment in relation to their financial decisions. Another incorrect approach is to dismiss the family's concerns and rely solely on the client's verbal assurances of being able to manage their affairs without further investigation. This neglects the social worker's ethical duty to protect vulnerable adults and the potential for cognitive impairment to affect insight and judgment. While respecting autonomy is paramount, it cannot be at the expense of the client's safety and financial security when there are credible indicators of risk. This approach fails to acknowledge the progressive nature of Alzheimer's and the potential for subtle but significant cognitive decline that may not be immediately apparent in casual conversation. A third incorrect approach is to delegate the assessment of financial capacity entirely to family members or legal professionals, without the social worker conducting their own independent, professional assessment. While collaboration is important, the clinical social worker has a specific role and expertise in assessing functional capacity and its impact on an individual's well-being and decision-making. Abrogating this responsibility would be a failure to uphold professional standards and regulatory expectations for a comprehensive evaluation. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough understanding of the client's presenting situation and the relevant regulatory and ethical guidelines. This involves 1. Active listening and information gathering from all relevant parties, including the client, family, and healthcare providers. 2. Conducting a direct, individualized assessment of the client's cognitive functioning and its impact on their ability to understand, appreciate, retain, and weigh information relevant to financial decisions. 3. Consulting with supervisors or colleagues when complex ethical or legal issues arise. 4. Documenting all assessments, interventions, and decisions meticulously. 5. Prioritizing the least restrictive intervention that effectively addresses the identified risks while maximizing the client's autonomy and dignity. Question 17. During the evaluation of an 85-year-old client living alone, who expresses a strong desire to maintain independence despite recent reports from their adult child about increasing forgetfulness and uncharacteristic hoarding behavior, what is the most appropriate initial intervention strategy for the clinical social worker to employ? Option A. Conduct a comprehensive in-home risk assessment that includes evaluating the client's cognitive functioning, functional abilities, environmental safety, and social support system, while actively involving the client in the assessment process and discussing their concerns and preferences. Option B. Advise the adult child to take over all financial and household management responsibilities for the client, without directly assessing the client's capacity or willingness to consent to such a significant transfer of control. Option C. Immediately recommend to the adult child that the client be moved to an assisted living facility, citing the child's concerns about forgetfulness and hoarding as sufficient evidence of immediate danger. Option D. Focus solely on addressing the hoarding behavior through environmental cleanup services, without a broader assessment of the client's cognitive status or overall safety in their living environment. The correct answer is A. Conduct a comprehensive in-home risk assessment that includes evaluating the client's cognitive functioning, functional abilities, environmental safety, and social support system, while actively involving the client in the assessment process and discussing their concerns and preferences. Explanation. This scenario presents a common challenge in gerontological social work, balancing an older adult's expressed desire for independence with potential risks to their safety and well-being. The professional must navigate the complexities of cognitive decline, family dynamics, and the legal and ethical obligations to protect vulnerable individuals while respecting their autonomy. The core tension lies in assessing the degree of risk and determining the least restrictive intervention that effectively mitigates that risk. The correct approach involves a comprehensive, multifaceted risk assessment that prioritizes the client's safety and autonomy. This aligns with the ethical principles of beneficence, acting in the client's best interest, and self-determination, respecting the client's right to make choices, as well as regulatory frameworks that mandate client protection. A thorough assessment considers the client's cognitive status, functional abilities, environmental hazards, social support, and their understanding of the risks involved. It also involves collaborative decision-making with the client, where appropriate and consented to, their family or support network. This approach ensures interventions are tailored to the individual's specific needs and circumstances, promoting dignity and quality of life. An incorrect approach would be to immediately impose restrictive measures without a thorough assessment. This could violate the client's right to self-determination and potentially lead to unnecessary loss of independence, causing distress and undermining the therapeutic relationship. Another incorrect approach would be to solely rely on the family's concerns without independently verifying the extent of the risk or engaging the client in the decision-making process. This could be seen as paternalistic and may not accurately reflect the client's actual capacity or wishes. Failing to document the risk assessment process and the rationale for interventions would also be a significant regulatory and ethical failure, hindering accountability and professional oversight. Professionals should employ a systematic decision-making process that begins with a comprehensive biopsychosocial spiritual assessment. This includes gathering information from multiple sources, observing the client's behavior and environment, and utilizing validated assessment tools where appropriate. The next step is to identify specific risks and their potential severity. Following this, the professional should explore various intervention options, considering their effectiveness, feasibility, and impact on the client's autonomy. Collaboration with the client, their support system, and other relevant professionals, e.g., physicians, legal counsel, is crucial. Finally, all decisions and interventions must be clearly documented, with a rationale that demonstrates adherence to ethical principles and regulatory requirements. Question 18. The risk matrix shows a client diagnosed with multiple chronic diseases, including advanced osteoarthritis and moderate cognitive impairment, expressing a strong desire to move into an independent living facility without any support services. Given the biological aspects of aging, specifically cellular aging contributing to joint degeneration, and the impact of cognitive impairment on executive functioning, what is the most appropriate best practice approach for the clinical social worker in gerontology to take? Option A. Focus solely on the client's expressed desire for independence and advocate for their placement in the independent living facility, deferring any assessment of their functional capacity or the impact of their chronic diseases to the facility staff. Option B. Immediately inform the client that their conditions make independent living unsafe and proceed with arranging placement in a higher level of care, as their biological aging process dictates a need for constant supervision. Option C. Accept the client's decision without further inquiry, trusting their judgment and respecting their autonomy above all else, even if there are objective concerns about their ability to manage safely. Option D. Conduct a comprehensive functional assessment to evaluate the client's capacity to manage daily living activities independently. Consult with the client's physician to understand the specific implications of their cognitive impairment and osteoarthritis on their safety and decision-making, and collaboratively develop a plan that respects their autonomy while ensuring their safety and well-being. The correct answer is D. Conduct a comprehensive functional assessment to evaluate the client's capacity to manage daily living activities independently. Consult with the client's physician to understand the specific implications of their cognitive impairment and osteoarthritis on their safety and decision-making, and collaboratively develop a plan that respects their autonomy while ensuring their safety and well-being. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a clinical social worker in gerontology to balance the client's expressed desire for autonomy with the objective biological realities of aging that may impact their capacity to make fully informed decisions. The client's history of chronic diseases, specifically cardiovascular disease and type 2 diabetes, directly relates to cellular aging and can affect cognitive function, energy levels, and the ability to manage complex health regimens. The social worker must navigate potential ageism, both internal and external, while ensuring the client's safety and well-being are paramount, adhering strictly to the ethical principles of self-determination and beneficence within the relevant regulatory framework. Correct approach analysis. The correct approach represents best professional practice by prioritizing a comprehensive assessment of the client's current functional capacity and understanding of their health conditions. This aligns with the ethical obligation to respect client autonomy while also ensuring their safety and well-being, a core tenet in gerontological social work. By consulting with the client's physician, the social worker gains objective information about the biological aspects of aging, cellular aging, chronic diseases, and their potential impact on the client's decision-making abilities. This collaborative approach allows for informed decision-making that respects the client's wishes as much as possible, while also addressing any potential risks or limitations imposed by their health status. This adheres to the principle of informed consent and the duty to protect vulnerable adults, as outlined in relevant professional codes of ethics and potentially state-specific elder abuse and neglect prevention laws. Incorrect approaches analysis. One incorrect approach would be to immediately override the client's wishes based solely on their age and diagnosis. This fails to uphold the principle of self-determination and risks ageism, a violation of ethical guidelines that prohibit discrimination. It also bypasses the necessary assessment of the client's actual capacity, assuming a decline based on biological factors alone, which is not a sound professional judgment. Another incorrect approach would be to proceed with the client's wishes without any further investigation into how their chronic conditions might impact their understanding or ability to execute their plan. This neglects the social worker's duty of care and beneficence, potentially placing the client at risk due to the biological realities of their aging process and chronic diseases. It fails to consider the interplay between cellular aging, disease progression, and functional capacity. A third incorrect approach would be to solely rely on family input without directly assessing the client's own wishes and capacity. While family can be a valuable resource, the client's autonomy remains central. This approach could lead to decisions that do not align with the client's personal values or preferences, and it fails to meet the professional standard of direct client assessment. Professional reasoning. Professionals should employ a decision-making process that begins with a thorough assessment of the client's current situation, including their expressed desires, functional abilities, and understanding of their health. This involves gathering information from multiple sources, including the client, their medical providers, and potentially their support network, while always prioritizing the client's voice. When biological aspects of aging and chronic diseases are present, professionals must critically evaluate how these factors might influence the client's capacity for decision-making without making assumptions. Ethical principles of autonomy, beneficence, non-maleficence, and justice must be carefully weighed. Consultation with supervisors or interdisciplinary teams is crucial when complex ethical dilemmas arise, ensuring adherence to best practices and regulatory requirements. Question 19. The control framework reveals that a clinical social worker is assessing an 82-year-old client presenting with increasing forgetfulness and a generally low mood. The client's family reports that the forgetfulness has made it difficult for the client to manage daily tasks, and they are concerned about the client's overall well-being. The social worker needs to select appropriate assessment tools to understand the client's cognitive and emotional status. Which of the following approaches best aligns with best professional practice in gerontological social work? Option A. Immediately administer the mini-mental state examination to thoroughly evaluate cognitive function, as this is the primary concern raised by the family. Option B. Select a general cognitive screening tool that is not specifically validated for older adults but is known to be quick to administer. Option C. Rely solely on informal observation and family reports to gauge the client's cognitive and emotional status, as formal assessments may be too burdensome for an older adult. Option D. Administer the geriatric depression scale first to screen for mood disturbances, and then, based on the results and observed presentation, consider a more comprehensive cognitive assessment like the mini-mental state examination. The correct answer is D. Administer the geriatric depression scale first to screen for mood disturbances, And then, based on the results and observed presentation, consider a more comprehensive cognitive assessment like the mini-mental state examination. Explanation. This scenario presents a common implementation challenge in gerontological social work, selecting and applying appropriate assessment tools when faced with a client exhibiting complex cognitive and emotional symptoms. The professional challenge lies in balancing the need for comprehensive assessment with the client's capacity to engage, the potential for iatrogenic harm from poorly chosen instruments, and the ethical imperative to respect client autonomy and dignity. Careful judgment is required to ensure the chosen tool is valid, reliable, and sensitive to the client's specific presentation, while also being administered in a manner that minimizes distress and maximizes accurate data collection. The correct approach represents best professional practice because it prioritizes a multifaceted assessment that begins with a less cognitively demanding tool to establish a baseline and gauge the client's current functional capacity. The Geriatric Depression Scale, GDS, is a widely recognized, validated instrument specifically designed for older adults to screen for depression, which can significantly impact cognitive function and overall well-being. Its relatively simple question format makes it more accessible for individuals experiencing mild to moderate cognitive impairment. Following this with a more detailed cognitive assessment, like the mini-mental state examination, MMSE, if indicated by the GDS results or observed presentation, allows for a more nuanced understanding of cognitive strengths and weaknesses. This sequential approach respects the client's potential limitations, avoids overwhelming them, and ensures that the assessment process itself does not become a barrier to care. This aligns with ethical principles of beneficence and non-maleficence, as well as professional standards for evidence-based practice in gerontology. An incorrect approach would be to immediately administer the MMSE without first considering the client's potential for depression or anxiety, which can mimic or exacerbate cognitive deficits. MMSE, while a valuable tool, requires sustained attention and comprehension that a severely depressed or anxious individual might struggle to provide, leading to potentially inaccurate results and a misdiagnosis. This failure to consider the interplay between mental health and cognitive function is a significant ethical oversight. Another incorrect approach would be to rely solely on informal observation without using standardized, validated instruments. While observation is crucial, it is subjective and lacks the reliability and validity of psychometric tools, potentially leading to biased assessments and inadequate care planning. Furthermore, failing to consider the client's cultural background and preferred language when selecting assessment tools can lead to misinterpretation and invalidate the results, violating principles of cultural competence and equity. Professional decision-making in such situations should involve a systematic process. 1. Gather preliminary information about the client's presenting concerns, history, and any known conditions. 2. Consider the client's current state of alertness, mood, and communication abilities. 3. Select assessment tools that are validated for the target population, older adults, appropriate for the suspected issues, e.g., depression, cognitive impairment, and sensitive to potential co-occurring conditions. 4. Administer tools in a manner that is respectful, clear, and adapted to the client's needs, ensuring informed consent and the right to withdraw. 5. Integrate findings from multiple assessment methods, e.g., standardized tools, clinical interviews, collateral information, to form a comprehensive understanding. 6. Continuously reevaluate the appropriateness of the assessment tools and process based on the client's ongoing responses. Question 20. Regulatory review indicates that an older adult client who has historically relied heavily on their adult children for social interaction and decision-making is now expressing a desire to reduce contact with them and engage more with a new group of friends from a local community center. The adult children are concerned about this shift, believing it is a sign of cognitive decline, and that their involvement is being unfairly minimized. They are requesting the social worker intervene to ensure their continued involvement in their parents' social life and decision-making. What is the most appropriate course of action for the clinical social worker in gerontology? Option A. Prioritize the adult children's concerns and immediately implement a plan that ensures their continued significant involvement in the older adult's social life and decision-making, as they are the primary caregivers and most familiar with the client's history. Option B. Conduct a direct, client-centered assessment of the older adult's current wishes, capacity, and reasons for wanting to change their social engagement, and then facilitate a discussion between the client and their adult children to explore these dynamics collaboratively. Option C. Advise the older adult that their desire to reduce contact with their children is concerning and recommend they continue with their established social network, as this is generally considered more stable and reliable for older adults. Option D. Inform the adult children that their parents' wishes are paramount and that the social worker cannot facilitate any intervention that limits their involvement, but also advise the children that they may need to seek legal guardianship if they believe their parent is incapable of making safe decisions. The correct answer is B. Conduct a direct, client-centered assessment of the older adult's current wishes, capacity, and reasons for wanting to change their social engagement, and then facilitate a discussion between the client and their adult children to explore these dynamics collaboratively. Explanation. This scenario presents a professional challenge due to the complex interplay of an older adult's expressed wishes, potential cognitive changes, and the deeply ingrained family dynamics that have historically shaped their social network and support system. The social worker must navigate the ethical imperative to respect client autonomy while also ensuring the client's safety and well-being, especially if there are concerns about undue influence or a decline in capacity. The family's long-standing involvement, while potentially supportive, also introduces the risk of paternalism or a desire to maintain control, which could conflict with the client's current desires. The correct approach represents best professional practice because it prioritizes a comprehensive, client-centered assessment that directly addresses the older adult's current wishes and capacity, while also acknowledging and exploring the family's role and concerns. This aligns with ethical principles of self-determination and beneficence, and regulatory guidelines that mandate client-centered care and the assessment of capacity when relevant. By engaging directly with the client and then facilitating a discussion that includes the family, the social worker can work towards a solution that respects the client's autonomy as much as possible, while also ensuring their support network is understood and potentially leveraged appropriately. This approach also allows for the identification of any potential elder abuse or neglect, which is a critical regulatory concern. An incorrect approach that focuses solely on the family's stated wishes without a thorough, independent assessment of the client's capacity and desires would fail to uphold the principle of client self-determination. This could lead to a situation where the client's autonomy is overridden based on the family's perception rather than the client's actual wishes, potentially violating ethical standards and regulatory mandates regarding client rights. Another incorrect approach that involves immediately implementing the family's preferred plan without exploring the client's perspective or assessing capacity would also be ethically and regulatorily unsound. This bypasses the essential step of client-centered assessment and could lead to interventions that are not in the client's best interest or that are imposed against their will. A third incorrect approach that involves isolating the client from their family based on the initial conflict, without a thorough assessment of the family's role and the client's desire for continued connection, would be detrimental. Social networks are crucial for the well-being of older adults, and severing these ties without careful consideration and client consent could lead to increased isolation and a decline in mental and emotional health, violating the principle of promoting social well-being. The professional decision-making process for similar situations should involve a multi-step approach. 1. Direct client assessment. Engage directly with the older adult to understand their current wishes, preferences, and perceived needs, assessing their capacity to make decisions about their social engagement and support. 2. Exploration of family dynamics. Understand the history and current nature of family relationships, including their support roles and any potential conflicts or concerns. 3. Capacity assessment. If there are concerns about the client's cognitive functioning or ability to make informed decisions, conduct a formal or informal capacity assessment. 4. Facilitated communication. Create a safe space for the client and family to discuss their perspectives, concerns, and wishes, with the social worker acting as a neutral facilitator. 5. Collaborative planning. Work with the client and family to develop a plan that respects the client's autonomy while addressing safety and support needs, drawing on the strengths of the social network. 6. Documentation. Thoroughly document all assessments, communications, decisions, and plans.